Myself Malliga and BSc Nursing, working as a nursing tutor at ES College of Nursing, Villupuram. Today my topic presentation is epistaxis. First, introduction about epistaxis. Bleeding from inside the nose is called epistaxis, fairly common and seen in all age group. Epistaxis refers to nosebleed or hemorrhage from the nose. It is mostly common originate in the anterior portion of the nasal cavity. Next, definitions of epistaxis. A hemorrhage from the nose, referred to as epistaxis, is caused by the rupture of tiny distended blood vessels in the mucous membrane of any area of the nose. Most commonly, site is the anterior septum, where three major blood vessels enter the nasal cavity. The anterior ethmoidal artery on the forward part of the roof. The sphenopalatine artery is the most posterior superior region, and the internal maxillary branches, the plexus of the vein located at the lateral wall under the inferior terminate. Types of epistaxis. There are two types. First one is anterior epistaxis, more common and less severe and easy to control bleeding. Posterior epistaxis, less common and more severe and difficult to control bleeding. Next, classifications of epistaxis. Anterior epistaxis, posterior epistaxis. The anterior epistaxis is more common, mostly from Little's area or anterior part of the lateral wall, mostly occurs in children or young adult, mostly trauma, usually mild, can be easily controlled by local pressure or anterior pack. Posterior epistaxis, less common, mostly from posterior superior part of the nasal cavity, after 40 years of age, spontaneous, often due to hypertension or arteriosclerosis. Bleeding if severe, requires hospitalization, post-nasal often required. Next, etiology of epistaxis, then congenital, trauma, infection, inhalation or illicit drugs, viral common cold, bacteria, rhinitis and sinusitis, nasal tumors, low immunity. Foreign body in nose, deviated nasal septum, nephritis, pulmonary COPD, congestive cardiac failure, hypertension, malignancy. Next, clinical features of epistaxis: nasal bleeding, fever, headache, body pain, giddiness, malaise, nausea, vomiting. Diagnosis studies of epistaxis: history collection, physical examination, blood test, blood pressure, coagulation studies, X-ray and CT scan. Management of epistaxis: first aid measures, keep the patient quiet measures, place the patient in a sitting position, leaning forward, semi-fowlers, apply direct pressure by pinching the entire soft lower portions of the nose for 10 to 15 minutes. Apply ice pack to the nose and check areas. Losing cloth and giving reassurance. Partially insert a small gauze pad into the nose. Bleeding nasty and apply digital pressure if bleeding is continuous. Take medical treatment if bleeding does not stop. Medical management of epistaxis. In case of epistaxis, it is important to know mode of onset, spontaneous or fingernail trauma, durations and frequency of bleeding, amount of blood loss, side of nose from where bleeding is occurring. History of known medical conditions such as hypertension, leukemia, cirrhosis. History of drug intake such as analgesic and anticoagulant drugs. Then medical management of epistaxis. Identifications of bleeding site by a nasal speculum or headlight. Little's areas, pinching the nose with the thumb and index fingers for about 15 minutes, compression of blood vessels. Tortoise method. Anterior nasal pressure with joint tongue depressor or first aid measures are unsuccessful in additional treatment. Next, cauterization of procedures. In anterior epistaxis, when bleeding is located, the area is first anesthetized and the bleeding point is cauterized with a bead of silver nitrate or coagulated with electrocautery. The anterior nasal bleeding. If the bleeding is perfuse and the site of bleeding is difficult to localize and anterior packing is done. For the repent gauze soaked with the liquid paraffin is used. About 1 m gauze 2.5 cm wide in adult to 12 mm in children is required for each nasal cavity. Pack can be removed after 24 hours if bleeding is stopped. Posterior nasal packing. It is required for patients bleeding posteriorly into the throat. A post-nasal pack is first prepared by 3 silk ties to a piece of gauze rolled into the shape cone. The nausea management of epistaxis. The nurse monitors the vital signs, assists the control of bleeding and provides tissues and emesis basin to allow the patient to expectorate or any excess of blood. Assess for changes in blood pressure and pulse if indicate hypovolemia. Assuring the patients in a calm, efficient manner, the bleeding can be controlled and help reduce anxiety. Instruct the patient provide blowing and picking nose after a nosebleed. Adequate humidifications may prevent drying of the nasal passages. The nurse instruct the patients how to apply direct pressure to the nose with the thumb and index finger for 15 minutes in the case of recurrent nosebleed. Complications of epistaxis: hemorrhagic shock, septic shock, pneumocephalus, sinusitis, septal pressure necrosis, epiporia. Thank you.